There's a lot of interesting things here pre-op that have to go in. We actually have a graphic which we'd like to bring up, which shows a lot of the very different things here, and I wanted to get the doctor to talk about these as well. This is all good, but this is all part of putting yourself at ease, taking out some of the stress. I think people need to understand stress is a killer, we know that. If you're going to undergo surgery, be calm. It will help you prepare, correct? All these things are good.
I think even before you see a plastic surgeon, you should be already emotionally prepared, because plastic surgery is not going to cure your depression. There are people who are undergoing a divorce or undergoing a difficult part of their life, and they go and see a plastic surgeon to change something. Oh, now I got divorced, I need breast augmentation. Oh, I'm getting older, I need a facelift, etc. And the reality is you got to be happy with yourself even before you undergo surgery, because now you're submitting yourself to undergo an elective procedure that potentially is much more stressful. It's going to be an additional stress to your life. So I think the patient should be prepared before you undergo any type of elective procedure. You should be emotionally prepared before undergoing it and be sure what you're getting into.
Let's go ahead and then look at physically as well. There's some things in here because the emotional side of things, we have this, it's about calm, it's about preparing yourself, but physically, there's one in there that I want you to explain here, prevention of DVT, PE before surgery. People may not know what that means.
So DVT and PE refers to developing blood clots in your legs that can potentially then go into your lungs. That's what we call a PE, which is a pulmonary embolism, and they usually form on your legs. And the reality is we have risk. If you're obese, you have a risk. If you're immobile, you have a risk. And one of those things that you think about is when you're undergoing surgery, you're going to be in an operating room for several hours undergoing a surgery. You're going to potentially be bedridden or immobilized for a few days, or your mobility is going to be restricted. So those are things that put you at risk for a clot. Now, and I know that I'm going to be talking a little bit moving forward, but people who are traveling, who do medical tourism, or people who come in to have an intervention, you're putting yourself at risk. Now, you're in an airplane. You're coming in to have surgery. You might be a few hours in an airplane sitting down, and now you're having surgery. You're going to be a few hours in the operating room. Now, again, you're immobilized. And then a few days that you're going to have poor mobility and then get on a plane. That's like the perfect setup for getting a pulmonary embolism and a blood clot in your legs.